So a lot of patients, parents ask me, why are we seeing such an increased number of injuries in our kids and our young athletes, and how can we help reduce that impact of injury? And I often refer to the olden days when we used to play multiple sports growing up, and we used to take time off from one single sport. Specialization in most sports didn't typically occur at such a young age as it does now. This early specialization in year-round sports-specific focus has really led to an increased number of injuries. We have an increased number of overuse injury. In fact, about 50% of all injuries that we see in the youth sports are from overuse injuries, and those are injuries we typically didn't see 20, 30 years ago. We also are seeing a significant increase in the traumatic injuries, such as ACL injuries or ankle sprains, those things, because of two reasons. One, the exposure, the number of games, practices, sporting events that young athletes are doing now is significantly more than it was growing up in an organized manner 20, 30 years ago. And two, we are also seeing that fatigue and just being worn down, your body does not respond very well to fatigue. Your body cannot absorb the same amount of forces in the same way as it can when it's fresh and prepared for the athletic activities. So those reasons are leading both to that increased traumatic injury and increased overuse injury, which is why we're seeing this epidemic, truly epidemic number of injuries in the youth population that we do now.